Are you finding that the people who would be the direct beneficiaries of this do trust, or are they buying into it, or fears?
Sure. Anytime a police officer shows up at the door of somebody that's involved in utilizing drugs, whether through legal prescription or otherwise, if they faced overdose, not real comfortable seeing a guy dressed like me walking in the front door. So that's why we really see this program being much more effective when we've got somebody from the LEAD program, a case manager, a peer support specialist going in. You don't have to have that though. You can we partnered early on with some of our substance abuse treatment providers right here in our community to go with us and do that handoff, where we would go in as law enforcement as far as a safety issue. Once that person becomes comfortable with the person from a mental health or substance abuse treatment provider, make that handoff and they can have communication from there. But it's important for us to get those two individuals together to try to get that person into treatment, because again, we don't care what it takes. We just want to stop that cycle of addiction, because eventually that's going to help us stop the cycle of crime, and that's what we're here for.
You know, it started out really slow because it took 8 days for the first person to actually come into the police department. And so, you know, by day 3, I'm thinking, you know, where is everybody? They should be, you know, lined up at the door. Not recognizing the fact that their interactions with law enforcement previous has been handcuffs and jail. And so there's obviously hesitation on their part. But once that first individual came in, I think word started to spread around that we were living up to our promises about not asking individuals who their dealers were, not arresting them if they brought in stuff. And so that kind of helped the program as well.
That's really important. Just that sense of, even if something's dictated to me, that's, you know, like, this is not, we're not here to put the cuffs on you. There's still a degree of trust, especially if someone is not in their, you know, their usual state of mind. Do you know how that first person was informed about it and how they got the confidence to come forward?
Yeah, there was an article in the paper that his aunt had seen, and so he was a military veteran. He had tore his ACL while he was in the military, was put on prescription medication, and then when his prescriptions ran out and he ended up leaving the military, he turned to heroin. And so she was like, I heard about this program, let's go down and talk to him. So by a leap of faith, I'm sure, you know, she brought him in here that day. And we spent 7.5 hours together in the emergency room waiting to get him into a room.
Wow.
Yeah.
So did that lead to some degree of success story? I mean, obviously it's better than
yeah, he's the very first one. He came in and he's still doing well. We sent him to rehabilitation and he's doing great. We paid for a plane ticket to send him to a different state because I was still unaware of the resources that were available in the state of North Carolina. So I've since come to realize there are resources, but at that time I didn't know anything about them or where they were. And we were fortunate here that we have a hospital that has a detox facility right next to it. And so there was procedures set up with them to be able to get those individuals through that initial stage of triage and detox to be able to move them on to the next step.
And so the first guy comes through, it was still kind of slow at first, or how did it build to where you...
Yeah, so in February, I think we had maybe just 2 or 3 people that whole month that came through. And then by March and April, we had started to see an increase. And so I think in the summer of 2016, when we started this, we were still probably only at about 35 people that had come through the program, which at that time I thought was a tremendous amount. That was, 35 individuals that were getting help that weren't going to be in the criminal justice system any longer. And from there, it just kind of, as word got out, it started to be 25, 30 a month. It was almost one a day.